but most people have not heard of andropause. So andropause is men's menopause. So men, unfortunately, have changes that happen starting in their 40s.
Everyone in healthcare has a story that they never forget. Some are beautiful, some are difficult, most are never told. This is the space and place where folks in healthcare talk about the moments that changed them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thanks for being here. I'm incredibly, incredibly delighted and honored to have Dr. Betsy Greenleaf with us today. Thank you, Betsy, for joining the program.
Thank you so much for having me. I'm so excited to be talking to you.
Yeah, this is great. So you are quadruple or more boarded in things that I can't even uh, pronounce, let alone it's really impressive. So you're the first board certified female urogynecologist in the United States, which is an unbelievable achievement. You're boarded in OBGYN, urogynecology, aesthetic medicine, functional medicine, and integrative medicine. And we connected because we have a colleague that works here in Arkansas who will be the first PEM doctor, Peds ER physician, who's an integrative medicine fellow, trained Zina Al-Haddad, who's been on one of our previous episodes, who's one of the most lovely people you can imagine. And Betsy's also the mom of two teenage girls, and one is looking at colleges, and then also the host of 40s Forward that I just was a guest on literally 10 minutes ago. We were talking on your show. And so honored to do that and honored to have you here, and welcome to HUMED.
Thank you. Yeah, I know it was just fun. We would do this little podcast swap.
I love it. I love it.
Yeah.
You know, that's part of the the journey of what we're doing. So, I'm going to turn it over to you. What story would you like to tell our audience
Yeah.
today?
Well, it's funny. It's kind of like, how did I get where I am now? Which is, I have a menopause andropause clinic, and so I mean, not to bore you and take it all the way from the
But wait a
beginning,
second,
but
before you even get into that, Menopause Andropause
yeah,
Clinic. So
yeah,
I know what menopause is. I don't even know
yeah.
what I'm so ignorant. Can you tell me
That's
a
okay.
little bit
Do you
about
know
what
what?
that means?
That is a really good question, because many people stop me on that exact one because they're like, I've heard about menopause, and especially menopause right now is kind of trending. It's
Yeah.
having its moment, but most people have not heard of andropause. So andropause is men's menopause. So men, unfortunately, have changes that happen starting in their 40s. That's why my podcast is called 40s Forward, because that's when everything starts to go downhill. So unfortunately, that's when, for many people,
Interesting.
testosterone starts to decline,
Yeah. Yeah.
and low testosterone is directly correlated with the increased risk of morbidity and mortality. So increased risk of death, dying, having medical problems. So yeah, so guys don't get off easy. They still have their own change that they're going through. It's kind of like, too, like you hear like guys will be like, oh, I've been working out, and then all of a sudden I hit my 40s, or it might be 50s for other people, and all of a sudden they get the dad bod, and they're
Yeah.
like, I don't understand. I'm eating the same. I'm working out the same. Like, why? Where's this coming from? And it's because of that decline in testosterone that starts happening in the 40s. Yeah.
Yeah, and it changes all sorts of things, right? It changes libido, interest
Oh,
in
yeah.
sex. It changes your
Motivation,
energy and motivation.
energy.
Yeah, it's interesting. So tell me a little bit. You're about to tell your story, but just you're just a very special human being. You're actually have 5 different boarded specialties. Can you tell me a little bit about how that sort of came to be?
Yeah. Well, I actually started, I didn't want to go to medical school. I wanted to be a veterinarian.
Interesting.
Medical school was my backup plan. But I was always interested in medicine. I just couldn't
Hmm.
decide between animals or people. And I got into medical school, not veterinary school. Being from New Jersey, there was no veterinary school here. So it makes it very hard unless you live in a state that has a school. So off I go to to medical school, which interesting, I thought, well, I'll do pediatrics because pediatrics is not much different than veterinary medicine, right? You can't ask the babies like any questions.
Yeah. Well,
I
babies do turn into children that do
I
talk
know.
at some
Yeah,
point. So.
yeah, at some point. I actually did not like my pediatric rotation. I was
Mm,
incredibly frustrated with dealing with the parents. Like the kids were amazing. I loved the kids, but the
yeah.
parents drove me like I think you have to be a very special person to go into pediatrics and they don't pay pediatricians enough. I don't understand the two professions that are preparing our future, pediatricians and teachers. Like, why do those should be the highest paid professionals
Yeah, it's
because
interesting.
that is the future, but I don't understand. They tend to be, the lower paid professionals.
Yeah, mostly
Um,
because we're not procedurally based.
yeah, yeah.
Procedures in the US system are get paid better.
Exactly. So I found myself actually drawn to the procedures. So that's what I like the procedures. And I started out actually in general surgery, went halfway through general surgery, and I'm like, yeah, no, this isn't for me.
Mm,
And at that time, I had met my future husband at the time, and it wasn't a good lifestyle to do general surgery, and I wanted to have a family someday, and I'm like, yeah. So I tried to fight the OBGYN thing. I didn't want to like that field. I tried to then go into ER because I was like, oh, shift work, this will be perfect, you know. Um, but unfortunately, I just couldn't fight it, and I really liked the OBGYN because I was the person I wanted to have a relationship with the patients other than just doing the procedures. Because when I did general surgery, I'd be the one going around on rounds and be like, "So, how do you feel now that your gallbladder's out? Like, how do you feel now that your appendix is out?" And like, general surgeons are like body mechanics. They do what they do really well, but they're not the feely, touchy kind of like kumbaya, let's have some like long-term relationship type of people. So I could combine that actually in OBGYN, but the problem with OB is that babies come at all times of the night, and I'm somebody who I found out I don't do well with lack of sleep. I just don't do well at all. So it wasn't until my senior year of OBGYN that I discovered urogynecology. And a lot of the listeners might be like, what is urogynecology? And I know even my mom, when I came home and I'm like, I'm going to do 2 more years of training in urogynecology, she thought it was like fancy gynecology, like European, like Euro Disney.
like EURO.
Yeah, yeah. And it's Euro having to do
Mm.
with urology. Like, so we deal with the pelvic organs, the bladder. We actually do stuff with the colon, but it had to deal with like bladder function and genital vagina uterus ovary type of functioning. So that's how I ended up there. But then I kind of you know I do have a funny story. One time during residency, I was eating lunch and I have a friend who's a podiatrist. And I remember I looked across the table at lunch and I'm like, "Oh, how do you look at nasty feet all day long?" And I think she like almost choked on her sandwich and she's like, "Do you realize what you're looking at all day long?" And I'm like, "Oh yeah, I kind of forgot that as a gynecologist what we're looking because you get descent in medicine. The more you are exposed to things, you become desensitized to those
Mm.
things and those topics. So you don't really realize what you're looking at. It's no big deal. And in fact, I have to sometimes watch my language because I'll say vagina like it's no big deal. And sometimes I'm out like, with non-medical people and I'm dropping, genital names and talking about, penises and vaginas. And people are like, oh, and I'm like, oh yeah, I gotta remember where I am and what I need to talk about. But,
But women, you had just mentioned this, but women who have who go through labor and have vaginal deliveries, they can actually through that process they can distort things in their pelvis.
oh
Is
yes.
that true in terms of their urinary system, in terms of their way their vagina is shaped? I mean, it just changes things, and as we age, it just continues to change, and that's part of the work. Some of the work is that a
Yeah.
fair assessment?
Yeah, so, 50% of women will have a prolapse, and a prolapse is basically our pelvic organs are basically open to gravity. I mean, there's not much holding it in other than ligaments and some skin and some bones and, well, no bones, but like connective tissue.
Mhm.
So you can get rips and tears during childbirth that can then either show up right away or not show up until years later. And now things are drooping and dropping and kind of falling out, which can affect, if we're emptying our bladder all the way, how's it functioning? Sometimes women will come in and like things are literally bulging out from below. And
Wow.
it's because they've lost those ligaments. And 50% of women will have a prolapse at some point in their lives. So it does go up higher if you've had children, but I've seen people just from constipation and bearing down to having bowel movements or hard coughs, asthma, like just that pressure, they can cause problems. Yeah.
Wow. So tell me a little bit. You also got involved in aesthetics. So what does that mean, and what was your intention around that?
Yeah, so the how I got into aesthetics was really interesting. So aesthetics is basically, trying to make people look look better. This may be skin rejuvenation, Botox, filler, all the things that people do cosmetically to make themselves look better. But also goes along with helps them feel better. But how I got into that was back in 2004 ish. Um, During when I first started Urogyne, we were using Botox in the bladder for overactive bladder because all
Hmm.
Botox does is it relaxes muscle. And
Yeah.
so sometimes the people with overactive bladder, they're getting bladder spasms. So then they have to go frequently. So we were using it for that purpose. And my patients would all say, "Hey, if there's anything left over, can you stick it in my face?" And I'm like, I don't know how to do that, but yeah, maybe I should go learn that. So and I went to a company that was called Empire Medical Training at the time because they had this membership where the other places were selling like one Botox class for like thousands of dollars, and they had like a whole range of classes. So I was like, wow, I'm going to go do it with them. So next thing you know, I did the Botox class, but then I was like, oh, wait, I get all these other classes in my membership. So it was like fillers and lasers and skin rejuvenation and fat dissolving and all these kind of things you see that med spas do. So, and now I actually teach for that organization. So I teach doctors and nurses how to do a lot of those procedures. But it all started off when we were using Botox in the pelvic floor and in the bladder, and then now I can stick it anywhere, pretty much anywhere.
That is so interesting. And so
Yeah.
I want to get back to the bladder spasm. And so how do you approach putting Botox in the bladder?
Yeah, so, overactive bladder, that's where people have to go frequently. They
Mhm.
may be it's like there's the commercials on TV, they're like gotta go, or maybe you're rushing or you're getting up multiple times a night. That overactive bladder, actually the risk of that increases as we age. So it can
Mm.
start as early in our 20s, but by the time we reach our 70s, there's more people walking around at any given time with an overactive bladder than has the common cold.
Wow.
So, and the adult diaper industry is gigantic, and people just think like, "Oh, this is just a normal part of aging," when there is so many treatments and even like more than what when I came out of training. When I came out of training, there was only two medicines and Botox, and then there's a pacemaker. We had four options. Now there's I think there's like 10 medicines on the market. Um, Typically, from an insurance-based standpoint, you have to follow their algorithm, which is you have to try and fail 2 medicines first before you can go on to the other therapies, but, some of the other therapies actually include an acupuncture type of therapy that insurance
Mm.
will often cover,
Wow.
and then the Botox is an option where we just go in with a little scope into the bladder, and we just inject it into the lining of the bladder. And then,
And you
like I
go
said,
you go through the urethra?
yeah. Mhm.
Okay.
Yeah. And that can be done either asleep, or we do it awake in the office. We just kind of put in a little numbing medicine, let it sit for about a half an hour, and then you come in and just put it in and you head home. And it takes about 2 weeks for the Botox to kick in. But yeah,
And is that for women or for men as well?
either one. Yeah, men and women. Yeah.
Wow.
Yeah,
Wow.
but it lasts only about 3 to 6 months, and then the Botox will wear off, but with repetitive use, you will actually cause those muscles to weaken a little bit, because what ends up happening is when you get bladder spasms, you get thick muscles, and you actually, when you look in someone's bladder, normally it should look, like, nice and smooth, but someone with overactive bladder, they'll have these really thick lines of muscle, and sometimes we can smooth those out over time, and they can get better function. Or some people just, they just come in and, we go, all right, let's try this and see what, and you just come in every, for your tune up every 3 to 6 months and get that done. But,
But
interesting,
if you think
not,
about it though, if you could do that 2 or 3, 4 times a year
yeah,
versus having to be in diapers,
yeah,
I mean, to me, that is a massive improvement in the quality of someone's life.
exactly. Yeah, definitely. And
And you're
diapers aren't
talking
cheap. They add up.
they add up.
Yeah.
So when we're talking about I'm just fascinated by this
Yeah.
concept, but, um, because I just turned 60 and I'm gonna be 70 soon.
Yeah.
But it's the next decade. But
Yeah.
the
Yeah.
but an overactive bladder are these people who are essentially dribbling during the day and they can't, or is it just that they're urinating frequently, or is it kinda both?
It could be either. It could be they are actually leaking, or
Mhm.
it could be that they're just going, like, so frequently.
Hmm.
But, from a more holistic standpoint, when we give into the bladder, like when you have to go, if you go every time you have to go, you actually train your bladder to be smaller. So there are things called bladder retraining where it's hard, especially if it's a patient who leaks, but with
Mhm.
practice, you can stretch the bladder out. There are people who are do like these yoga people that have stretched their bladders out like ridiculous. And in fact, actually, nurses and teachers, they usually have the largest bladder capacity because over the years they've had to hold it because
Yeah.
they can't leave their classroom or they can't leave their patients. So teachers and nurses tend to hold at least 2 liters. They can hold anywhere from a liter to 2 liter, and
Holy
think of a two
moly.
liter bottle of soda. But
Yeah.
like an average bladder is half a liter. So think of a quarter of a 2 liter bottle of soda. That's average. But then people, if the more you give into it, you're telling your brain like to run the show. I mean, you're telling your bladder to run the show versus
Yeah.
over time you can change that and kind of rewire things. Yeah. It takes
So
some practice.
so now we're on the 3rd, uh certification that you have board certification. And by the way, for our audience to know, I have one, which is now pediatric emergency medicine.
Most people
Good
have
enough for
one.
me. Good enough for
Most people
me.
have one.
Yeah, yeah. But just so you know, even just managing one and becoming one is a big deal. I mean, I had to do a 3-year fellowship, in a 3-year residency in pediatrics, and 3 years of peds ER, and then you have to do all these things all the time to sort of maintain certification, which I'm assuming is the same for OBGYN with maintenance of certification and all these different little things you have to do. You have to stay on top of it. But I want to get into we've connected because of a colleague of ours that we have in common around the work she's doing in Arizona
Mhm.
around integrative medicine, and then you also said you were board certified in functional medicine. So let's talk a little bit about that. So what is the difference between integrative medicine and functional medicine?
I know it. For the longest time, I wasn't sure, and I still am not exactly sure because there's a lot of crossovers.
Yeah.
But integrative medicine more so takes a little bit of all the different areas of health and wellness and medicine and kind of combines it. So it'll look at Chinese medicine. It will look at Ayurvedic medicine, which is based out of India. It will look at energy medicine. It'll look at things like mind, body, spirit medicine. So it's all little areas, but it also acknowledges that there's a role for traditional medicine. Functional medicine tends to be more root cause, and these are generalizations because there's a lot of crossovers between the functional and integrative, but functional gets more to like root cause. Like instead of like, let's just give you a pill for everything, let's find out what is the cause and let's treat that cause and see if we can change things. So functional medicine tends to be a little bit heavier on doing some specialty testing. Through it, I'm very passionate about microbiome medicine. And so that has to do with the microbiome is each area of our body has its own like universe of microorganisms, bacteria, yeasts. And I have found through what I've done, is that the gut microbiome really is a driver for a lot of our health and disease states. So that's an area that I become extremely passionate about.
Yeah, and it's one of the areas from my understanding, I have limited understanding of this, that's one of the last bastions of the unknown. Like, we have billions and billions of bacteria in all of our guts, like, each of us
Yes.
have
Yes.
billions, and then, we don't fully understand 'em, correct me if I'm wrong, but we don't fully understand the relationship between the kinds of bacteria and what you call the microbiome, and what that how that relates to one's personal health. Is that a
Yeah.
fair assessment?
They are uncovering it as we speak. It's something like ongoing. And so and even I see companies coming out with different types of probiotics, and we're
Mm,
not exactly it's hard to I use a lot of probiotics, but it's hard to officially recommend certain ones because I still don't know really the full activity of some of these bacteria and what they
mm.
do. But there is a very fascinating connection between our gut microbes and even like our thoughts and behaviors. And from a pediatric standpoint, this one's my favorite. This is my favorite example. So there's a lot of talk and a lot of studies about how gut bacteria affects how we behave.
Mm.
And there's one in babies, Bacillus infidus, and they found that Bacillus infidus tends to be very low in colicky babies. So when a baby's colicky and crying and having all these problems, what do parents do? They're like, I don't know why you're crying. Let me change you. Okay, you're changed. You're good. Okay, let me feed you. So it affects the behaviors of the baby by making the baby cry, and then it affects the behavior of the parent by the baby. They'll go and feed the baby. So by feeding it, now the bacteria is getting its nutrients and it's able to replicate. And so when Bacillus infidus is at a certain level, it won't trigger that irritability in the baby. So, which I think is so crazy that like this bacteria could be affecting how we behave just so that it could get food and replicate. And I think they're starting to find that and even including it in a lot of the formulas and things for infants now. So, yeah.
Yeah, it's really, really interesting. There is some evidence. We tended earlier in my career, less so now, but we continue to give antibiotics for various things,
Mm.
some of which are indicated, some of which are not indicated. The biggest flagrant foul, so to speak, that we were overdoing it was over-treating ear infections
Yeah.
and with antibiotics. But to this point about microbiome, antibiotics, whether it's adult or kids, from my
Yes.
understanding, you're an adult physician, um, antibiotics really have a dramatic effect on the
Oh,
microbiome. Is that correct?
oh, yeah. And in fact, I see it drives me crazy all the time because as a urogynecologist, I would get a lot of patients with urinary tract infections, and most physicians have been trained to throw ciprofloxacin at the problem. Um, Great for killing things in the bladder, but it also is going to kill the gut, and one course of ciprofloxacin can throw off the gut microbiome for up to a year. So it can take
No,
a full
for a
year
year to
to
recover.
recover. And so then the problem is what I've connected with my patients was that the people that are getting recurrent bladder infections, it's not the bladder that's the problem, it's the gut
Mm.
because they get an overgrowth of the bad bacteria in the gut for whatever reason. But they get E. coli, um, I'm blanking out on some of the other ones. But E. coli being the biggest one that causes urinary tract infections. And because the anus is very close to the vagina and then the urethra, it's the gut that is the reservoir for the bacteria, and then it gets into the vagina. The vagina acts as a reservoir, and that brings it closer to the urethra for women, and that's why women are at more risk of recurrent urinary tract infections than men. So, and it really comes back down to treating the gut and getting the gut healthy.
That's fascinating. Many of our folks that are listening to this podcast are learners who are studying to become physicians and other aspects of healthcare. You are such an interesting person, Dr. Betsy Greenleaf, because you've done so many different things, and I didn't even know that you even started a surgical residency, which I'm sure gave you some really good base training.
Yes.
I mean, you
Yeah.
were probably way ahead when
Yeah.
you first started your OBGYN work because you had some basic surgical competency
Oh, yeah.
under your belt and experience. So, and you're a mom, right? And
Yeah.
and we talked about this in one of our other shows that, um, at least it's my opinion that um, uh, medicine is secondary to family and friends. And the most important thing in life is giving and receiving love. And
Mhm.
sometimes we lose that in this crazy
Mm.
world that we live
Yep.
in. So I want to know how we talk about life balance and balancing life and whatever. And I hate to use that as a sort of colloquial term, but how are you balancing your life and what are you doing? You have like 5 things to pick from that you could be practicing. Uh, how are you structuring your life with medicine and what kind of medicine? And then also, how are you structuring your life with your daughters?
You know what? I would say for a very long time, there was no balance. And honestly, it took the universe to come in and stop me to get me to realize things because I was putting medicine before my family. There were so many things I missed out with my family over the years because I was like, oh, I have to work or I'm on call or I need to be around. And I would just blow off everything with my family to the point where I finally got a job that I hated, but even then, I wasn't ready to quit. I had a job where they told me I worked for a hospital and they told me, see more patients, spend less time. And I just like felt like I was a factory and I was miserable and I hated what I was
Mm,
doing, but I didn't know how to stop. And so I look at this as lucky, but I'm going to tell you, people are like, oh my God. So I end up having a car accident. I was driving to work one day and somebody couldn't get to Walmart fast enough and they pulled across 3 lanes of traffic into the back of my car. Um, but that's what took me to stop because all of a sudden it was like, wait a minute. Um, it helped me. I got out of that horrible contract with that hospital that I couldn't stand working for because I had a disability clause because of that contract. Um, so that was good. The only bad side is I no longer do surgery
mm,
because I did injure my neck and I don't have full use of my right hand. So, doing surgery was not an option anymore. But even then I was told like, all right, just sit down and be retired. And you can tell from all the things I do, I'm not a person that sits still.
mm,
So, I actually was speaking and teaching and somebody asked me a question about menopause at one of the medical conferences that I was teaching at. And next thing you know, I announced, and I don't know why I said this. I was like, I'm opening a menopause andropause clinic. And I have no clue why I said that. But now that's where it is. Um, but how I balance things now is really, honestly, my calendar is my best friend. Like, I use the calendar like my personal development tool. I schedule in my shower, I schedule in my lunch, I schedule
mm,
every little thing in the day because I found that, like, when I was working before, I wouldn't even eat lunch some days because things would creep into that. I make sure that we have a family calendar. I make sure that the family, the kids are asking me, like, hey, can I go do this with my friends? Put it on the calendar because if it's on the calendar, it blocks that space. So even when with the new clinic, I don't take insurance, and that was a way for me to protect my sanity and time and be able to do the things I wanted to do because a lot of the things that I do isn't covered by insurance. But then I also don't book that many patients during the day because I don't need to be the factory putting out, people every 5 minutes. Like I like to spend an hour with my patients and like develop that relationship. So, but there are days that I work and there's days I don't work. And even when it comes to sleep, I used to be on call 24/7. Now I tell the patients, like, you can get a hold of me, but not after 10 o'clock at night and not before like 8 o'clock in the morning. So, if anything's happening during those times, then, you need to see your primary or go to the ER or go to urgent care. But the other times I'm around because my sleep time has to be protected. Not that I'm sleeping 8 o'clock in the morning. I'm still, but, I have to protect my time that I exercise, so I'm getting up and exercising. So, I schedule everything because otherwise things will creep into those spots. And next thing you know, you're not eating, you're not sleeping, you're not spending time with your family. So, yeah, the calendar has become my best friend.
Well, that's so interesting. I think we're all those of us that are multifunctional now. I'm managing not just medicine, but also, hosting people and uh, finding times to meet and talk. But I want to talk. You had said a gift from the universe, and I want to come back to that. And when I want to connect the dots here. So when you said gift from the universe, that was the car accident that you
Yeah.
had that sort of like said, okay, now I've got to take care of Betsy. Is that
Yeah.
a little bit of what
Yeah,
happened?
I think I manifested it because I didn't really mean that I wanted to get into a car accident, but there were times where I was so miserable in my work just because they were working us like
Mm,
crazy at the hospital. And there were times I was driving home so exhausted that I would actually pray to have a car accident because maybe I could then get like a week off and get some rest. But I
wow.
didn't really mean that. Like, and certainly when it finally happened, I was like, oh shit, like now this is we I didn't really mean that, but like I said, it turned out to be I don't think I would have stopped the madness and the craziness. And luckily, I wasn't I was injured, but not enough where I couldn't still, live my life. So it was enough to be like this wake up call, like, all right, you need to start paying attention to stuff. So
Mm. So I want to just come back to this. I mean, we could be talking, like you said, on your other show for hours, and I do want to wrap it up in a little bit, but hormones and hormone replacement therapy, it seems like there's been a lot of information and evidence that has happened over the last 10 or 20 years. And we spent some time today talking about sort of women's stuff. I would like to talk just for a few minutes about the man thing. And
yeah,
so men um, over time have lower and lower testosterone levels, which from an evolutionary standpoint, again, please correct me if I'm wrong. I'm just sort of
yeah,
I don't wanna make stuff up, but from an evolutionary standpoint, it's because as you get into your 40s and 50s and 60s, you don't need to have children anymore. So your
exactly.
testosterone drops and your sperm count drops and you become less fertile,
Yes.
correct?
Yeah. So from an evolutionary standpoint, it all makes sense.
But
But
not if you wanna be, active and alive and have a high quality of life in your 40s, 50s, and 60s.
exactly.
So
Exactly.
what does testosterone do? So and there are different ways of giving testosterone, right? You can
Yeah.
take a shot, you can take oral pills. I heard from another podcast you can do some sort of subcutaneous
Yeah,
depot
pellets under the
pellets.
skin
Yeah.
that absorb over time and, topical creams or patches. So there's a lot of different options, yeah. W
Do you have a go-to option for the men that come in, or is it really
my
what their choice is?
Yeah, my preference is the shorter acting. I don't like oral. I don't like oral at all, I can tell you that. Because the reason I don't like oral is because you have to take so much because it goes through the liver before the body sees it. So it's really affecting the liver. So I don't like people using oral at all. I like the topicals or the short acting injections and why I like and I do the pellets, but I like the shorter acting ones better because it keeps your receptors sensitive.
Mm,
Because your receptors will tune out over time something that's at a steady state. If you have, like me, if you have teenagers and you're like, hey, clean your room, clean your room, clean your room, they tune you out. They don't listen to you because you're saying it to them all the time. So
sure.
it's the same idea. If you're blasting your receptors with the hormones constantly, your hormones will tune it out. And so one of the problems with the pellets is people will be like, oh, I felt great. And now it doesn't work. It's not that it didn't work and it's not working anymore. It's just you're tuning it out. So you
Mm,
actually need to give yourself breaks between the pellets to get those receptors sensitive. Where the shorter acting ones, you get a natural up and down every day and that's actually how it happens. Testosterone is highest in the morning. So another thing, if you're going to get your testosterone tested, it's going to be highest in the morning. We Men also have seasonal variations to testosterone levels, and that we can't really replicate in medicine, but um, in North America, in northern countries, the testosterone is highest in men in August and September, and lowest in January, February.
that's
And
so interesting. Is there
yeah,
a reason why?
do you know what? I've tried to find out. The theories are it may be sun exposure and vitamin D,
Hmm.
but they don't know for sure. But if you think about it from an evolutionary standpoint, it kind of makes sense. So if your testosterone is higher in August and September, then maybe you would impregnate somebody around that time. And then 9 months later, they'd be giving birth like maybe in the springtime. So I don't know.
No, that's really, really
Yeah,
interesting.
from a survival. That's all just purely guesses. Nobody knows for sure, but it makes sense. Yeah.
What have you noticed in terms of your male patients once they've started on hormone replacement, testosterone therapy? What have you noticed the changes in their life?
Yeah, energy, motivation,
Mm,
help with brain fog, because these hormones, all the hormones are neurotransmitters too. So we think about the effect on the, reproductive system, but they have a really, important effect on the brain. So if you're getting forgetful or you can't find words, that could be from low testosterone. And so we give testosterone to the women too, and they have, we see both, increased energy, increased confidence, increased motivation, increased sex drive. My only problem is what I'm seeing now is because hormones have become really popular, is people are getting hormones thrown at them like they're candy, like they're this
interesting.
panacea. It drives me absolutely insane that you can go online, not even see a practitioner or a physician, put your information on, and then all of a sudden you're getting these hormones showing up at your doorstep, with
Wow.
all these online companies. Because what they don't understand, and this is where I include the gut microbiome in all my patients, is I could be supplementing you, but if you're under stress, your stress could be turning your sex hormones into cortisol. So you could be taking hormones and people just throw more. Well, oh, they don't work. Let's throw more. You may throw more. Well, we need to go and find what's your underlying stress. And is your stress not getting enough sleep, not drinking enough fluid,
Sure.
eating an inflammatory diet? Is your gut microbiome off? And that's being perceived as a stressor, because there are studies that have directly correlated gut microbiome in both men and women to low libido. So, we do know that this is all connected. So it's not just throwing hormones at the problem. And I'm like, right now, I'm losing my mind about this because I'm very passionate about don't ruin hormones for us. Don't take, because it's a tool, and don't take the tool away from us, because too many people are doing it now because it's popular. And then we're going to see problems. And then it's going to get, the FDA is going to blame the hormones, and then they're going to take that away from us. It's not the
Interesting.
hormones. They have to be done, and they also have to be done in balance. Because if you go out of balance, your body can't detoxify from them, and they go down these metabolites, these toxic metabolite pathways that can, not will, but can potentially trigger cancer. Because that was the whole thing too. Like, oh, hormones cause cancer. No, hormones don't necessarily cause cancer. It's if they're not in balance, and if they go down this one pathway, and if we're not using natural hormones. So that's the other problem, is that there's non-natural hormones on the market, and the reason they exist is a pure business decision, is you can't patent anything that naturally occurs in the body. So, pharmaceutical companies do what businesses do. They take a molecule that naturally occurs, they tweak it. Now it's a novel, new item that they can patent, they can protect their intellectual
Mm.
property, and now they can sell it. So those were the hormones that were the issue when people freaked out about hormones about 20 years ago. But we now know the natural hormones in balance don't cause those issues. So,
Well, I would love to have you on the show again at some point because we could,
yeah.
like you said at the end of your podcast, we could probably talk for hours, and it's been delightful. So I'm a lifelong learner, and one of the things I loved about your show is you asked a question that I'm going to turn on you.
Yeah.
What did I not ask you today that you would like to share with the audience? Is there anything that we didn't talk about that you feel like you want to get out
Well,
there?
really quickly is how I ended up getting interested in menopause and andropause was I had my own surgical menopause at age 40, and all my symptoms were being blamed on menopause when it wasn't just menopause. I didn't realize I had a gut microbiome problem. And
Mm.
so as I was trying to figure out my own issue, because I was getting sick all the time and I was having some depression and anxiety, which is very out of character for me. And turns out when I finally went into functional and integrative medicine, I was like, wait a minute, what does getting sick and anxiety and depression have in common? And that's your gut. So 90% of your happy hormone, serotonin, is made in your gut. 80% of your immune system is made in your gut. So I just went down that road of figuring out how to rebalance my gut, and then now over the years I've been able to connect it to hormones, I've been able to connect it to libido, longevity. Now they're even finding out that I just saw recently there was a probiotic that's came out for Alzheimer's because they realized that there's certain bacteria that may be missing in the gut in people with Alzheimer's. Obesity, we know that patients who are obese have a different microbiome than people who are thin. So, and the easiest way is look at what you're eating. And I always say your food should fall into 4 categories. It should be something that at one point walked, swam, flew, or grew, because Doritos don't grow on trees. There's no free range Twinkies. So that's an easy, simple step. Every time you put something in your mouth, figure out if it fits into those 4 categories, and then you should be eating it.
That's a great analogy. The other analogy I learned from another podcast on HUMED was on the outside of the aisle in the supermarket. Like on the outside of the aisle is where you find eggs and poultry and fish and fruit and vegetables, and
Yeah.
on the inside is all the processed stuff. So
Yeah.
well, thank you so much for joining. Pleasure and honor to have you seriously on the show. I've interviewed and had an opportunity to meet a number of folks not on the show, but in my career, and you are an interesting human being, and
Thank you.
really, and you've done such remarkable things. And I think anyone who is listening to your 40s Forward podcast or is fortunate enough to be a patient of yours, I think you're really adding a lot um, to the world. So thank you so much.
Thank you for having me.
So for those of you that are listening, please subscribe on YouTube, Spotify, Apple Podcasts, wherever you get your podcast information. This is Dr. David Spiro. I hope you all have a great day.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.